welcome back to the living room. We're so excited to have everybody here. My sister's in the background. I don't know if you guys at home can see her right now. I'm trying to fix the TV. I think she hit a bad button. Thank you all for being here tonight. Thank you to everybody online who's chiming in. I hear there's a lot of you, so I'm really excited to have you. Tonight's going to be a little bit different. As some of you know who have been with us for a few years, this is our holiday meeting. So it's a time for celebrating our successes, talking about what's going on with all of you. It's our patient roundtable. So I highly encourage everyone online to chime in. Andrea will be aggressive with assuring that your questions get heard and that your concerns get heard or your good stories get heard. We're going to do an around the room. Like I asked you all last month to do the patient survey. Thank you, thank you, thank you to all of you who filled it out. We actually got a ton of responses after harassing you all several times. I know that we did. But we really appreciate it because everything we do here is for all of you. And we want to know what we can do better, what you guys might need that we aren't providing and how we might be able to provide it. So we really, really, really appreciate your feedback. So we're going to go over a little bit of some of the results from that. But like I said, I want to start with the around the room. I want to wish everybody happy holidays and thank you for weathering the storm and coming out. I feel like they said the storm of the century was coming last week and it's rained the same exact way ever since then. So it doesn't make a lot of sense. So I don't know if you are in the back. Melise, who's over here, has your mic. There are some new folks in the room. When you talk, so the people online can hear what you're saying, we will need you to grab a microphone. Everybody in this sort of inner circle has mics that they can pass around, but if you're on the back and you'd like to say something, Melise will be shuffling a handheld mic back and forth to you. So I don't know if there's anybody. Oh, I should also announce that Lily is in the room tonight. They're doing a story. Some of you may or may not have heard. They have a new drug that was just approved by the FDA for non-small cell squamous. So they're here doing a story tonight, and Neil has been out there visiting with them at a meeting in Florida and talking with them and giving the patient perspective. As we all know, he brilliantly can. So they're here to do a little piece tonight.
And he dressed down tonight for
did dress down
for the film. Yeah, right.
Right. Yes, right. Nobody can see you. Nobody can see you. Nobody can see you. So I don't know if there's a preference on who wants to start, if somebody wants to raise their hand for our around the room and where we are and how we're doing, and if you have any questions or concerns or anything you just want to ask the group.
Let's start with Neil, since they've got a camera on him right now.
Oh, yeah, they do. Whoops.
There you go.
So, thank you. I have been doing a video for Eli Lilly Company for the last couple of weeks and invited the crew to come down and see what the living room was all about and also to talk about a couple of things that Danielle and I have discussed. I'm Neil Schiffman. I'm 66 years old, and I was diagnosed 3.5 years ago. So, like most of the other patients here, I am extraordinarily glad that we have a patient advocacy organization in San Carlos that was founded by Bonnie and Tony and her daughters, and that it was so close and has been an incredible help to me. But I wanted to talk a little bit about patient advocacy from the other side. We know what we're getting from the foundation here and how much it has helped all of us in so many different ways. But on the other hand, there are so many patients, both within the room, who are in the area, who are watching this online, and I'll say hello to my mother. That's why I wear all these colors. She's in Sarasota, Florida, and as soon as she sees bright yellow, bright orange, or anything bright, she knows it's me. She doesn't have to worry about adjusting the computer or anything else. She'll watch it tomorrow because it's past her bedtime, but that's okay. That's how it is in Florida. So when I think of patient advocacy, one of the things that I've learned from coming to the living room and coming to the foundation there and being kind of infected by Bonnie, Danielle, and Andrea is that I'm a patient and I can be an advocate in so many ways. Now, it's easy when I'm feeling well, and it's very hard when I'm not feeling so great to have those kind of thoughts. And I know it's the same for all of us here. There are days you don't want to get out of bed, you don't want to do a few things. However, I have to say that we can provide, each of us here and in other places that we may talk with patients, because we've told Danielle or Andrea that we're available to do that. We can give so much information. I can give you an example. When I first had to undergo CyberKnife, I had it explained to me by my doctor. I was able to see the CD they gave me, but I was extremely frightened by the idea of having this beam go into my head, and was it going to blow up or what was going to happen? So what I did is I found out through the foundation somebody who had already had it, and I said, "You still alive and you can breathe and you can talk? Because here's what I'm interested in." And that calmed me down a little, and what calmed me down the most was going through it, and my head was still in one piece. And I said, okay, and I've had many treatments since that time. So since that time and other occasions, I've made it my point to try to be there for other people who may have a question, not just about CyberKnife, but about Tarceva. And most of us have had that over the course of the last few years. When you first have it, what's going to happen? What can I expect? I think it's our responsibility to advocate for all of those people out there who just get the news or who find out something that they didn't know about, but they can call up and say, "Gee, I'd like to talk with somebody who has experimented with Chinese medicine. What's that all about? How can that possibly help me? My doctor won't even talk about it, but do you know anybody who does it?" Well, I have a friend who does, and she gave me a lot of information about it that I probably wouldn't get anywhere else. And it's that way that I think we have that responsibility to go forward and be available to other people when we can and give them our knowledge if they're interested, be a sounding board for them. I talk with people now in Chicago area, in Salt Lake City, Utah, in Beaverton, Oregon, in that part there, and I understand, I think, the frustrations that a lot of these people have because they're not lucky to live in our zip code, to be able to get the kind of care that we get around here. So they're going to a community hospital that's not one of the ones that's listed as a community hospital of excellence. That's part of the foundation's work throughout the United States to try to make it equal for everybody. Because I think just because we live here doesn't mean that we necessarily should get better. I think overall we do, but how can we help other people? So I would urge you, if it's within you, to give the information, to give the knowledge that you have learned, either as a caregiver, and I'm sorry my wife's not here tonight, but she had to go somewhere else, or as a patient, or maybe you're a professional in the field and you make yourself available, as I know at least one behind me has. He's made himself available to me many times, so I appreciate that fact. I also want to talk a little bit about clinical trials, and I've talked about it many times over the years. And I just read something by one of the doctors at Mass General Hospital, which was to the effect that nothing going forward is going to happen in terms of new therapies, either immunotherapies, targeted therapies, unless we put ourselves out there and participate in clinical trials. Now, some of us, it may not be appropriate for, but many of us look at it, but haven't really looked at it to find out that this is the way medicine advances. I mentioned Tarceva before. Some of you maybe have taken afatinib or cetuximab, Avastin, Alimta, any of those. Where did they come from? They came from people who participated in a clinical trial. And I thank God that people did the Tarceva one because it gave me a great year to start off with versus perhaps another treatment that would not have been so good. So there are so many places that the information is available. Maybe you don't hear it from your doctor, but the foundation has it online. Cancer Commons, which is in Palo Alto, has a listing. You can always go to clinicaltrials.gov, take a look through the morass that's there, spend some time, and find out. It may be that's not appropriate for you today. I haven't been on a trial for a year. However, I'm getting ready to go on one in 2015, and I've been looking every week. I check it out, see what's available. I don't look at the ones that have nothing to do with me, because there's too much to read with the ones that possibly can help me out. But my doctor has always said, there are 26 letters in the alphabet. I'm on E as far as the 5th line of treatment, so I got a lot more to go. But she wants me to know, and I want to know, what's out there. I rue the fact that I was diagnosed 3.5 years ago and wasn't diagnosed today, because it's changed so much in that time. There's so many things available. Immunotherapy being one of the biggies, what Dr. Gandera had talked about when he was here recently. But I know it's important for me to know what's going on there. It's my life. I want to live. I have a lot of things to do. Clinical trials, I think, are one of the ways that's going to get me through some of this. Because I'm on a systemic treatment right now. I don't particularly love it. It's working okay, but it's not going to work forever. None of them do yet. But I want to be able to be on a trial and have the chance that it will become the standard of care for somebody else 3 or 5 years from now, but I got a head start on it. I got first dibs on it. Just like the right people who got Tarceva, when they had no hope, all of a sudden something was found and it helped a certain number of people. I know nothing's going to help everybody. I'm looking for the one for me. You have to look for the one for you. Take a look at it. The information's there. It's too important to let it go by and not think about, is a clinical trial in my future, whoever you may be. You decide that for yourself, but at least be open to it. And around here, we have 3 great places: Davis, UCSF in the city, Stanford, are available, and they do tremendous work.
Can I ask you a question, Neil,
Sure.
while you're talking? What role do you think clinical trials have made in chronically managing your disease this far?
Well, I would say I was on a trial all of 2013. When I went on it, it had been from a systemic 2-chemo cocktail, which I wasn't in love with, and I couldn't wait for the first day that I started the trial. I'm sure that I personally had overall a very good 2013, much better than I had expected, even though I progressed at the end. But it's a drug that is now closer to being approved, and because of that, I'm happy that maybe I had a teeny part so that someone else will get it in the future and have at least as good an adventure with it as I had. And that's why, and when I was approached and thought about clinical trials, so I've had a positive experience. That makes me more apt to look at them in the future. However, I know that it's the wave of the future. It's where we're going to get, eventually, managed disease as the foundation wants to have by at least 2023, if not sooner. I don't know why we have to wait that long. But if we participate in these trials, we get closer to it. Without those trials, it's not going to happen. And then,
Well, I think that's an important point to make. I know, actually, a lot of the comments on the patient survey was like, why do we have to wait till 2023? And it's like, understanding that by 2023, it's what we want for everyone, right? Everyone diagnosed. But right now, we're seeing it happen. And the point I was trying to make earlier about what role do you think they've played, were it not for those clinical trials, where might you or might not you be, right?
yeah. I know I wouldn't be as well as I can be. I like to characterize myself as excellent health, except I have lung cancer.
Yeah.
I want to keep it that way for now, with the hope that it can be managed better. I have no doubts whatsoever that without the medications that have been available to me on the trial and in other ways, I wouldn't do as well. No doubt whatsoever. I'm always surprised that I'm still here. You know, so when I wake up, I'm happy for that. And then finally, and thank you for your indulgence tonight with this, most of you who have known me for any period of time know that I am very crazy about exercise. And fortunately, I have a doctor who understands that, and anything I do is fine with her, even to the point of going out for bike rides during the middle of clinical trials and that part there, it's okay. You know, I've always been told by the doctors I've seen over the years, keep yourself in good shape. And it has made, I think, paid dividends to me, the fact that I came into getting lung cancer, that I had been in very good shape. And all the way through, my doctor has pounded into me, although she doesn't have to, but she says it kind of automatically, I want you to be in the best possible shape you can, so if we start a new treatment, you're starting at the top. And 9 weeks ago, when I started this 3 chemo cocktail, I was glad I was at the top, because within 3 days, I went to the bottom. And it was pretty low, but I rebounded, and since then it's been okay. But I suggest to you that even on tough days, when maybe it's hard to get out of bed, and I brought a little device to show you that one thing that if you're looking to buy something for somebody for Christmas to help them and maybe motivate them, is we have found, whether it's a Fitbit or Nike Fuel Band or a Jawbone, that quantifying the exercise can be a very good way to get somebody into it. I'll take an example. My own father, who had a knee replacement a few years ago, and he is not an athlete. He'd just as soon sit at the desk. He was a CPA. He could sit down for 24 hours without a problem. I can sit down for 24 seconds. So that didn't come from him. It came from my mother. However, after he had his knee replaced, I went to visit a couple days later, and we would, every commercial, we would walk around the house a little. The next day, he took his walker, and we walked out, because the doctor told him, you got to do a little walking. You can't let it, whatever it was, freeze in one place. So we walked, and we would go out about one house down, turn around, and come back. We do that a couple times during the day. The next day, we went out, and we went out to that house. So I said, okay, you can turn around now. My own father amazingly said, I want to go to another house. This is like unbelievable. This is from someone who likes to sit down all day long. So that taught me that in most cases, as long as we're well, reasonably well enough to do it, that we need to be in motion. We need to go out. We need to exercise. And if it helps with a device, and all you can do is 100 steps, what we found the next day is most people try to do at least 110. And then it keeps on going. And then they get in such good shape, they say, I don't have lung cancer anymore. I can walk 5 miles. I can do the walk that the lung cancer puts on in Dallas or in Irvine or in Chicago or the one in San Francisco. I mean, how great is that to start off at 0 and do 3.1 miles, 3.1, a few months later. So I would just suggest for any of us who are patients to keep yourself as physically fit as you can. It's not going to make it worse to your disease, but it's got a chance to make it a little bit better. So with that, thank you. Thank the foundation for being here. It is a tremendous resource for me, I think for all of us. So Bonnie, Danielle, Andrea, Tony, Scott, everybody else, Michelle and Melise and Gunit, and all the other people who have become friends over the years. Who else behind me? And Henry, my friend over here too. So thank you very much. I, as a patient, and I hope I speak for other patients, say, I know it was terrible that you got cancer 10 years ago, but what happened after that has made so many people's lives, especially my own, so much better. Thank you, thank you, thank you.
I want to say hi to Neil's mom and ask her how she raised such a shy, reserved guy and how lucky we are to have him. And you're a hard act to follow. Anyway, I'm Sally. I entered the International Early Lung Cancer study. Anyway, and I was found, I was at high risk. I've been a smoker. I hate to admit it, but I smoked 30 years. And I also had a lot of family members with it. That's why I entered this study. And after 5 years in the study, one of my insignificant little nodules changed, and I had lung cancer. But I was very fortunate. It was found right away. I had surgery, and I'm 5.5 years out, and I have lots of little nodules, but they don't change, and that's all I care about. So, and I thank also all of the foundation. I don't know what we'd do without you. It just, even though I haven't gone through what some of these other people have, it's just, I've met wonderful people. And as I always say, something good comes out of something bad, and something good was meeting all of you.
Well, you know, to Neil's point about patients advocating for yourself and for others, Sally went to a meeting for us in San Francisco last week because we couldn't go. And it was a meeting to discuss early detection screening in the Bay Area. And she was with some docs from UCSF and others, and you know, we called her and she said, sure, I'll go. So she sat in the meeting and had amazing input, you know, because she's been in an early detection screening program for over 5 years. So,
and it's
a wonderful experience. Yeah, it's great.
It's one of those things, and you know, Neil kind of touched on it about, you know, advocating for not only for yourself but for everyone else diagnosed, right? And how can we do that? And it's amazing the ways you find yourself doing it without even really knowing that's what's happening, whether it's through this group and something that any one of you could say that's going to touch someone either online or someone that goes back and watches it later. You have no idea the impact you're having on the many lives, right? And people that are diagnosed. And Neil has gone and spoken not only on behalf of the foundation, but been the voice of the patient. And we talk to you guys all the time about the voice of the patient's what's needed in this disease. It's so desperately needed in this disease. And Elizabeth's, we had her fly out to New Jersey, and she was her, you know, the voice there. And Neil's been to Florida, and Sally was just in San Francisco, and anybody who wants to fly anywhere, people are asking us all the time. So just let us know. No, but it really is important because we can't affect change until people hear from you, right? I mean, we need the Army, like my mom talks about all the time, and you guys are the Army.
I have to get, you know, for one, my comment in on about this. You hear all the time, and we have some people here from Celgene and Clovis. You hear all the time, and Lily, you hear all the time about translational medicine. And what that is something that's been discovered at the bench and goes back to the patient. They say from the bench to the patient. I say no. I say transformational medicine research, because it starts with the patient. It's from the patient to the bench and back to the patient. Without you and without the tissue you donate and the blood and the plasma and all the other things we donate, there would be no research. So you're the first line in research, and you need to know that, and you really need to understand how important that is, because there would be no clinical trials, there would be no new drugs, it wouldn't be happening without you. So it's doubly important that you do all you do, and you contribute all you contribute to the process. You're part of the solution.
Hi there, I'm Julie Bauman. This is my first time here. I'm here for my sister-in-law, Merce. Hey, Mercy, I'm thinking of you. She was diagnosed 18 months ago with lung cancer, EGFR, and she's been on treatment through Stanford with Dr. Neil, and right now we're great in that things are not growing. They've stabilized, so she's just doing the Alimta every 3 weeks. She's had a headache for about a month, so I was a little worried about that, but the good news was the brain MRI yesterday said that nothing had grown, so we're just trying to manage the pain for the brain. But I'm just here to kind of soak all this information up and hopefully have some wisdom when this treatment doesn't continue to work, what our next step will be. So that's it.
Okay. There's lots of next steps.
Hi there, I'm Scott. I'm with the film crew for Neil, so I'm just observing.
We'll have one.
I'll speak for her.
Right.
I've been speaking for her for 42 years. This is my wife Carol. I'm Martin. And this is our best year ever. Even though she was diagnosed, we're together. We're fighting this together. She has a non-smoker, non-small cell, if I'm saying it correctly. And she's currently under treatment at Stanford. She takes the oral chemotherapy called Xalkori, and with Dr. Wakely. And we had a scan at the beginning of December, and it was very positive. The radiologist said significant decrease in size. So that's all we could hope for, and we say 2 thumbs up. Let's go forward.
Hi, everybody. Merry Christmas, by the way. Most of you probably know who I am, but my name's Elizabeth Lacasia. Believe it or not, I was diagnosed in 2007. I've gone through several surgeries, several types of chemos, including a couple targeted therapies. I would just want to speak to a couple points that Neil brought up, because I think they are so important. I firmly believe that I would not be here today if I had not participated in a clinical trial. It gave me access to a drug combination that was absolutely, it was done in such a way that was contrary to traditional thinking. It was a combination, a time combination of Alimta and Tarceva, because at that time I was noted as being wild type because I had had the molecular and genetic testing done. My oncologist, Dr. David Gandara, decided to take a calculated risk. He said, I think we're going to go for a Hail Mary here because other therapies didn't work. And he said, we'll know in a few weeks if this doesn't work. We knocked it out of the park. I'm a complete outlier. I was on that treatment for 78 cycles. I had to go off the Alimta because of issues with my creatinine. In other words, my kidneys were having toxicity issues. Since that time, I progressed, and that was a clinical trial that I was on, and I had participated in several others. I currently had molecular and genetic testing done about 6 months ago, and when I first had it done, just to give you an example, they were testing for about 7, what do you call them, mutations, essentially. Now they're up to over 350. So I said, hey, let's test it again. And we found out that I wasn't wild type, that I indeed had the ROS1 mutation. So when I progressed, I went on to Xalkori or crizotinib. I'm doing extremely well, as you can tell. I've grown my hair out since all the other type of chemos, and my Tarceva hair is manageable and growing out. But I firmly believe that clinical trials are not something to be afraid of, and this is why. I was in actually in biotech and researching oncological products. Clinical trials are a little different in cancer. You never get a placebo. You will always get a treatment if at the minimum it's standard of care. So that is the baseline. What you get is access to a drug that is being tried. And sometimes, maybe phase 1, phase 2, or a little bit, they're testing dosing and things like that. But trials doing 2B, 3, they are very rigorous. And the quality of care that I got on my trial was absolutely top shelf. I was having CT scans, I was having follow-ups. My treatment then, quite honestly, is more rigorous than my treatment now, not being on a clinical trial. I'm not saying that the quality of my care is any less, but the follow-up and the input and the contribution that you make as a patient is incredible, and you're helping all of us by learning from your experience. And my philosophy is, well, dang it, if I have to have cancer, somebody might as well benefit from this. And if it's not me, hopefully it is, but it's hopefully those that follow in our footsteps. And so what we're really trying to do is, I personally advocate participating in clinical trials, but having a resource, a knowledgeable resource like the Dr. Ganderos or the UCSFs or the thoracic oncologists that are out there that really know their stuff. They can give you guidance and help you figure out which trial is the best for you. Second thing I'd like to mention is that for those of you that are lucky enough to get to the point that Neil and I are at, where our cancer is being fairly well managed, we would like you to help us. And by participating however you can, whether if somebody has cancer, giving them guidance. If nothing else, tell them about the foundation. If it's somebody that's going through a treatment that you are currently on or have been on, for instance, I was on a Lipton Tarceva, I talked to another number of people how to manage the side effects. I'm not a physician, I don't propose to be, and I don't represent myself as being, but you have tremendous experience anecdotally from your experience, how, for instance, you dealt with the skin issues, how you dealt with the intestinal issues, how you dealt with the nausea. All these sort of things are rare little gems of information that someone would dearly love to have when they're in the height of dealing with all these side effects. Because the best thing to do is to stay on the treatment, stay on the clinical trial, stay as healthy as you possibly can, because this is a long race. We're in this for the long run. Hopefully, all of us will be able to get to a point where we're chronically managed. So those are my 2 cents worth. And hopefully, we are all a resource for each other here. I try to be that for other people, but we look for other people to do that also, because we can't do this ourselves. And there's a trite saying about, it takes a village, and it literally does, especially with lung cancer, because it is such a lethal disease that those of us, if you can possibly give back somehow, even in a small way, it is incredibly helpful.
So, Liz, I want to ask you, and back to Neil, too. So you guys have been so vocal about where you are in this process, right, and what your beliefs are. At what point, understanding that patients are in all different phases of this, right? Some are newly diagnosed. They're still trying to deal with what they've, sort of been handed down. And at what point did you sort of turn that corner? Yeah, into someone who was, I'm choosing to live with my cancer, and this is what living with it looks like.
That's a really good question, because I think that's such an individual thing. I think part of it was that when you're finally able to get to a point where somehow, even with all the things that are going on, it somehow starts to become, you start seeing kind of cycles, whether you're on like the more systemic chemos, okay, day 5, I'm really going to get blue, or I really can't sleep, or it really hits me. So you start kind of planning for those days, and you start kind of seeing the cycles where you have good days and not so good days. So that kind of, in a strange way, kind of brings some sort of relief, because you're like, okay, I can deal with this because I can plan for this a little bit. So if you can get to that point, and kind of take solace in that, knowing that hopefully there's a light at the end of the tunnel, and that this, all the things that are going on will get better. Because, for instance, with this current treatment that I'm on right now, Xalkori or crizotinib, when I first started taking it, it absolutely hit me like a ton of bricks. My not to get too much information, but I started having a lot of tremendous side effects. My kidneys were starting to, and my liver were starting to not shut down, but get pretty darn close. And what happened was that, and this is what my GP and I surmise, is that there were so many dead and dying cancer cells in my body, it couldn't deal with it, and it was having a hard time flushing the toxicity. And man, you feel like hell. But hindsight of that was kind of like, yeah, it's killing the cancer. As long as I can survive this, super. So it's just a matter of trying to kind of understand, and that's what's helped me and kind of empowered me is kind of, Lord knows, Bonnie knows, I ask a lot of questions, but it helps me to kind of understand, and maybe it's a control thing, but just kind of understand what's going on. The turning point for me, I think, was when when I didn't feel so alone in this disease, where I felt, okay, I was not so much a veteran, but I'd been on the treatment for a little while, and other people started asking me or just anecdotally saying, you know, I know somebody that just got diagnosed. Can you talk to them? Or someone comes up to me at the living room and said, you know, I heard that you're on Tarceva. I'm having these terrible side effects. How did you deal with them? And I would say, well, anecdotally, this is what worked for me. And it just was empowering because I felt like somehow, even though how terrible this experience was, hopefully I could help someone else and make it a little easier for them. And I think that's what really motivated me and motivates me to this day. I try to be the person I wish I had when I was diagnosed, because when I was diagnosed, there was one clinical trial on my disease and they basically cut it out, or your history. There were no clinical information on it. Bonnie knows, because I was diagnosed basically a year and a half after she was. There was no information. And if there was, one oncologist would say one thing and another oncologist would say another. There weren't the targeted therapies. Things have changed so radically in the last 5 years. There's so much to look forward to and hope for that it's literally, you're just trying to survive this until a more appropriate treatment comes along for you, for us. So, and it's just, for some reason, you just get to a point where you figure out, okay, I have cancer. For whatever time I have left, how am I going to live with it? How am I going to live my life? And
I remember,
yeah.
This was a couple years ago, and Elizabeth was sitting over there, and she was very sad and very, what's the word? Not optimistic at all. And she was talking about the fact that her husband wanted her to go on a trip to Spain. And so I said, well, why aren't you going? And she said, well, I have cancer. And I said, you can have cancer in Spain, So she went. She had a blast. Now we can't stop her from traveling. She's going all over the place.
Yeah, I just got that.
I think what you're talking about is, it's kind of a coined phrase now, but it's a new normal. Mm-hmm. It's a new normal. And once you get beyond the shock of diagnosis and all the newness of this new normal, somewhere along the way, it settles in that you have cancer, and this is true for anybody with any kind of cancer, and it's a new dawn, and it's a new day, and you have no choice but to run with it,
right.
And try to wrap your arms around it and, manage it.
Right. And I think to Bonnie's point in talking about this trip to Spain, they were basically telling me that I had less than 6 months to live. I did not look the way that I look now. I looked terrible. I was going through, triple carboplatin, Gemzar, and Avastin, and it was taking its toll. I was sick, but the thing was that I was able to time my trip between my treatments. And you have to realize that you have different limitations at this point. I'm not a skier anymore. I don't rollerblade anymore. I don't do a lot of the things that I used to, but I still go out and I walk. I still exercise as much as I can, and it's doable. When we were in Spain, there were certain days where, like you said, I could only walk around the block. But you know what? I was in Spain. I mean, walk around the block there, sit and have tapas in a bar. Okay, I can do that for a few hours. It's a good thing. You just have to be a little realistic that maybe check out, okay, if something does happen, is there an oncologist there? So you do a little bit of research. Maybe you make sure that if you need oxygen, you know, you have a POC or there's oxygen on the plane. You don't do it blindly, you do a calculated risk, but it shouldn't stop you from living. If anything, it should heighten your zest for life and to do the things that you've put off doing.
And we have doctors all over the world, so we can connect you wherever you want to go. Yeah. We highly recommend getting out there and doing things that you want to do. Okay.
We need to get you
there's your mic. Thank you, Elizabeth.
I like that couch.
I'm Chris Harrison. I was diagnosed in February of this year with stage 4 non-small cell lung cancer. And immediately they put me on carboplatin, Alimta, Avastin, the standard of care, basically. And
the old one.
What?
The old standard of care.
I guess.
Get tested.
Yeah, and I went 9 cycles on that, and then my tumors started growing back, and I felt like such a failure. I didn't know that the really, you know, until a doctor said to me, "Oh, it's really good that you went that long." I had the old-fashioned thinking where you go to the doctor. You know, when I was a kid, you go to the doctor, you say, "This hurts, fix it," and the doctor does, and you turn yourself over to the doctor, and you trust them, and it's their job to take care of you. And it's taken me a while in this last year to realize that they can't do that I have to advocate for myself. I can't just, and the people who are not here tonight are the people, I think, who just said, well, I'll just do what my doctor says. And first time I came here, which was probably March, maybe April, I called my girlfriend afterwards who had introduced me to this, and knows Bonnie. And I said, I've found my people. These are the winners. These are the fighters. These are the survivors. I want to hang out with them. And so I started learning how to advocate for myself. And it's not easy, and it's a lonely task. So when my tumor started growing again in September, maybe October, my doctor immediately wanted me to go on the next standard of care, which is docetaxel, yes. But by then I had learned a lot here. Like, it never occurred to me to ask if my oncologist specialized in lung cancer. I heard it here, you know, at 6 months in. How would I know to ask that question?
Right.
You know, I'm pretty well educated, and I'm not in this area, obviously. Anyway, so I told my doctor I wanted to wait and go get a second opinion, and I went to Dr. Gandera, and I told Elizabeth, said, oh, I've been seeing him for more than 5 years, every 3 weeks, and look at me, you know, and I said, I can do that. Well, we tried to get me into, he did another biopsy. We tried to get me into trials, an immunotherapy trials that he has going on right now. There are 3 arms, and one is X amount of the new drug. Second arm is Y amount of the new drug. Third arm is docetaxel. And I drew docetaxel. I found that out a week ago today. I came in here weeping in Michelle's arms and said, help. What do I do now? I said, I don't want, you know, and they wanted me to start like the next day to keep the trials going. And it didn't seem appropriate to drive all the way to Sacramento to take what I could take here, for one thing. But also, from the doctors, I'd gotten, they kept kind of saying, well, let's try to avoid the docetaxel. Let's do something else. But so what we did is, I'm set up now I'm going to see Dr. Neal at Stanford on Friday. And meantime, my tumor's growing. I'm taking some risks here. And I'm willing to take those risks because Dr. Neal has 2 different lung cancer immunotherapy trials going on right now, I understand. They won't really tell me what the protocol is. But I hope to get into another one. If not, I fall back to docetaxel and wait for the next thing. But I know that on Dr. Gandera's trial, had I been on docetaxel already, I would not have qualified for the trial. So, I don't feel like...
For the immunotherapy.
Right. Yeah, exactly.
Right.
So, I didn't want to, again, get on it last week, So I'm up in the air. It's scary. All the side effects that I used to deal with are gone, and I had other stuff going on. That it took me a while to figure out that my oncologist really didn't want to hear about those sinus headaches and, and my old bones in my neck and shoulders that were aching me. And so, and that it's my job to keep the rest of my body, like you said, in really good shape so that he or she can focus strictly on the cancer, So my breathing is getting more difficult, and but I did a lot of walking around the city this weekend, just slowly. But I'm doing it, and I got some grandchildren that want me around for a long time yet. So
we do too.
I intend to be here, and I got to tell you guys another cool thing. What's your name again? Lucy just walked in. She said she's been watching us on TV.
Yeah.
And she said she felt like she knew me because she's seen me on TV and heard me talk. Like what?
She said you're a movie star.
A movie star. She thinks I'm a movie star. Or a friend, Isn't that cool?
Yeah.
That's really cool. It's working. In Alcoholics Anonymous, they say you can't keep it unless you give it away. In other words, you don't just go to meetings and take. You pass it on. I've been sober many years, and I have women I sponsor, and I have a sponsor, and she has a sponsor, and we work with each other, and we help each other. That's what you guys are doing here. It's the same thing. It's like you talked about. You get so much. The joy I've gotten from giving it away in AA has been, just life-changing. And you guys are doing the same thing, so thank you.
I'm Lucy. I'm actually a primary care doctor, but I'm not here because of that. I'm here because my husband has stage 4 lung cancer. And actually, Neil, a couple years ago, he was on the other side of the cyber knife. He finished neurosurgery residency at Stanford. His name's Paul. And it's his kind of patient voice that he's been working on. Is that he's always kind of been a writer, and he's been writing about the experience of being a physician and then becoming a patient, and how he kind of used to. He wrote an article in the New York Times earlier this year called "How Long Have I Got Left?" and it's kind of about how he used to think about prognostication and then how he kind of felt it as a patient. And he's been doing some more writing since then. And had to switch from Tarceva to chemo and had some bumps in the road. And so writing was really kind of buoying him up too. And kind of to what you said, I think this has been one of our best years yet too. We've been married for 8 years and we just had a baby. Her name's Katie and she's 5 months old. So Paul is at home with Katie right now, but he might be...
Did he dial in?
He might be.
Okay.
I'm not gonna. I got a Christmas present idea actually, so I guess I won't talk too much more about that.
Okay.
In case he's watching, I don't know. But it's great to be here. We live pretty close, which makes it easy to come with a baby in the rain on a rainy night. But we went to the gala last month, and it was so awesome. It was so. I felt like for the first time in a while, we kind of really let our hair down because we didn't really have to explain anything. And it was kind of like, I don't know, sometimes it's like we go to a wedding these days or we go to something else these days and it's like we feel a little bit different because we have some different stuff going on. And in a way, I've realized that everybody has stuff going on. It doesn't matter if it's cancer, it doesn't matter if it's something else. I feel kind of like both being a physician and a patient and a caregiver, you get this empathy for other people sort of no matter what it is. But particularly at that event, I thought, these are our people and let's party. So I really loved it. It was great to be there. It's great to be here tonight. Thanks for having me. And I guess that's all I have to say.
Yeah.
Thank you.
Yeah.
Sally needs a mic. Sally needs a mic.
To see a doctor that was going through what so many people here in this room and watching are going through, it was absolutely fantastic. And thank you.
Well, you know,
Pass it on.
this cancer, as we all know, is a very stigmatized cancer, and sadly, and it's stories like we're hearing tonight and making all of this human that are going to change that. How is it possible that a neurosurgery resident who's 37 years old gets stage 4 lung cancer? He's obviously not smoking, you know, in school. It's helping. It's really helping. And when people like your husband write a story like he did, that's helping. It's helping get the word out that really anyone can get lung cancer.
Well, and I think that's the sad reality, right, of this disease, and it goes back again to why all of your voices are so important, regardless of what your smoking history may or may not have been. And we all know here in this room that you don't have to smoke to get lung cancer. And at the end of the day, whether you did or didn't, it doesn't matter. We are still people, and we still deserve better than what's currently available, right? So that's where we're kind of coming from. With that being said, it's getting out there and advocating and telling stories and showing the person behind the disease as opposed to what people assume the disease looks like. It's so important. So through blogging and advocating and being here and being the celebrity on TV that people are watching that you don't even know, right? It's so important. And that goes back to what I was saying earlier. You guys have no idea the impact you're making. And I have thanked a lot of you who have been with us since we started live streaming this over and over for sharing what our small, group, what we started with just us in this room, what we are being able to bring to people not only around the country but around the world with this show, if you will, is amazing. So
and we had a visitor this week, just 2 days ago, from Arkansas. A young mom with her 2 babies here and her husband. And I promised Jody I would give her a shout. Yeah. Are they online? Yeah. I promised I would give them a shout out tonight. So, hi, Jody.
Well, and it was so cute because they came in here with Taryn and Taylor, their daughters, and I can't remember which one of them said it. And it was during the the storm of the century, like Katrina 2 or whatever was supposed to be hitting the Bay Area. And I was like, "Are you sure?" Because they were visiting Jody's uncle down in San Jose. It's like, "Are you sure you guys want to drive up?" And they're like, "We are not coming to California and not coming by and seeing the people who have brought us the most hope since this whole thing started," right? So they were adorable, and they walked in, and like I said, I can't remember which one of the girls said it, but she looks at me and she's like, "Hey, you're that lady on TV." That's me. Yeah, it was cute. It was cute. So
they were darling.
Yeah,
so
it was cute. It was cute.
Yeah.
Yeah. So.
Miss Terry.
Who has been sharing her story?
Right.
My name is Terry Fry, but I'm here because my daughter, Natalie DeMarco, was diagnosed in March of 2010 with stage 4 non-cell lung cancer. She has 2 daughters. It was actually on the 1-year birthday of her youngest daughter that she found out that she did have lung cancer. So it was, it's been quite a journey. We've been through a lot of, we've seen a lot of doctors. We've attended a lot of living rooms, and we've experienced, but one of the things that, and Natalie's gone through several different stages during her journey, and at the first year, she was very obviously scared, but she really tapped into her support group, which was myself, her dad, my brother, the living room, and she kind of sat back and watched. And then the second year, she gradually got a little bit more exposure and whatever, but now she's willing to tell her story. She's done some speaking or articles and stuff, but she went through the 6 rounds of the combo first time, and we were hoping that she was going to be able to get a surgery done to take out the NPP, take out her whole left side, because at that point they didn't think it had gone anywhere else. So we were back, and she went back to Boston because to get ready for the surgery, and they tested her lymph nodes, and it was in her lymph nodes, so that disqualified her for the surgery, which in my mind was a blessing, because her health at that point in time wasn't, I don't think she would have survived it. So she went on 43 rounds of, first it was Alimta and Avastin, and then she just went on Alimta. And during that process and during getting more knowledge and everything, we found out that your doctor just can't be the only person that you rely on in your care. And we actually started to build up a team and get more knowledge. But from the living room, she found out that about the going in and getting the non-invasive biopsy. So she had a stubborn spot in her left side. So they went in, and it all tested negative, but she still felt that she wanted to zap that one spot. So they did do the targeted therapy, which she also learned from the living room at Stanford. And so that was basically 2 years ago that she had the one spot zapped. So January of, 22 months ago, her and her doctor decided that she could go on a chemo vacation. So she's been off of all chemo since January, 22 months ago. And she had a scan in November, and she's all good. So now she has to go, she was getting scanned every 4 months, and now she can go 6 months. She does, from the very beginning, we have complemented the Western medicine and the chemotherapy and everything with also Eastern medicine, Chinese medicine. So she's been going to acupuncture 3 days a week ever since she was diagnosed. She does sometimes take some breaks, but and she is also on some Chinese herbs and medicine. But mainly, one of the biggest things that the Eastern medicine helped Natalie is just the way of being in tune with her body. She really, she still takes a lot of time out of the day focusing on, she really hears and listens to it, and she'll go and either lay down or rest, or with 2 girls, or when she gets overtired, she pulls back, which she never did before. She basically, and then also her acupuncture, Dr. Wu, would never, it's always positive. Positive thinking is a very strong essence, and I really do believe that the both have complemented each other, and that's one of the reasons why Natalie is doing so well. So that's our story, but I do want to thank the foundation. I think I started coming here very shortly after I had learned about them at Stanford support group, but then started coming, and we've been a part of this community for quite a while, and we want to thank you for everything that you've done for us.
And Natalie came down with me to San Diego and spoke at an American Cancer Research meeting, ACCR. And she and Emily both spoke, and you could have heard a pin drop in the room, because these people that work in the labs and they're at the bench, and they don't see patients. It's amazing when they hear patient stories, and they get charged, supercharged about, what they do, and get very excited about making things happen. So she did a great job.
One of the things is to tap into what this woman said is I think everybody, when you're just faced with the normal colds and whatever, do go to a doctor and pretty much leave your health up to them. But when you are faced with a bigger journey with regards to lung cancer, and I can't really say because I don't have it, but I watched my daughter really become the driver of her care, and by getting educated and knowledge and tapping in and researching everything. And I think that's when she turned the corner and really kind of accepted, because she could plan and she could make her decisions of their treatment. She could have her plan B and plan C, and that's the turning point for her.
Well, I think I hear from talking to patients all the time, there's that loss of control, right? When somebody says you have cancer, all of a sudden you don't get to say necessarily what happens next, right?
But you do.
But you do, right? And again, that goes back to what we were talking about with Elizabeth. At what point do you kind of turn that corner? And it's when you really start, what I have found through the people that I talk to, it's when you really start taking charge and saying, okay, I do have some control here, right? I can educate myself, I can do the research, I can go out, I can ask questions. Even if I think they're stupid questions, I'm gonna ask them because I am gonna be in charge. And then it's amazing to see how as soon as that happens, there's this shift in the way that people are dealing with not only their everyday lives, but with how they're fighting their disease.
To Danielle's point and to Terry's, the doctors are starting to adjust to this new process. We had a live stream in Chicago, and Danielle and Scott were in Chicago, and we had 3 doctors on the panel, and I was dialing in. It was the first time I dialed in because I'm always here. I never had to dial in before, so I'm watching them, and all of the questions going to the doctors on the panel, and Tom Lynch was one of them. And he was kind of really taken aback by, all these questions coming in. But when in the final analysis, he said, you know what, that was amazing. Yeah. That was really an eye-opener to actually have patients being so direct and asking such direct questions.
I think it was like, well, Dr. Lynch, so-and-so in the patient. He's like, okay, I get your point. Like, right. Point heard, point taken, exactly. And I agree with you. I think you're right.
Right.
That's all we really needed to hear.
So. We always know when Natalie's dialing in because she'll ask a question to one of the docs and we go, that's Natalie.
Yeah, that's
we
Natalie.
Always know it's her,
yeah.
who it is.
Larry.
So thank you.
I'm Larry. This is my first appearance at the living room, but I feel like I'm an old hand because I've seen either via live stream or through the library probably the last 18 to 20 living rooms. The first one I saw Terry Fry, whom I've known for 30 years. And I was diagnosed with lung cancer on February 13th, 2013, stage 4, metastasis to the brain. I did 5 rounds of Alimta and carboplatin. The results were phenomenal. The first brain MRI showed that the metastasis was no longer visible. There was the PET scan showed that there was no metabolic activity in the tumor in the lung or in the lymph node, and I've been very fortunate. I had after that point I did Alimta for many more cycles until December of last year. I've been free of any active systemic therapy since then. In March of this year, my brain MRI revealed that the metastasis had returned and that there were 2 additional small spots of metastasis. So I did CyberKnife, and I've had 2 scans since then that were very positive. The last one was stable for 2 of the items. The main metastasis, the original one, was inconclusive, so we're waiting to see the next scan in January for that, and I have a PET scan again in January. I'd like to just talk to some of the points that you folks have brought up tonight, particularly addressing Neil's comment about being physically fit. I was diagnosed in June of 2013, a month after my scans had shown that I had no active cancer in my body with type 2 diabetes. I had been sedentary for the majority of my life. I had high blood pressure. I was on 2 blood pressure medications. I had been borderline diabetic pre-diabetic for many years. I was borderline high cholesterol. All those things that, you do when you're sedentary. So I was fortunate enough to find a person to help me with my diabetes. And I had chemo the day before I met with him. And my regimen, or it was actually on Tuesday, I met with him on Sunday. On the weekend, I was always very tired. So I talked to him on Saturday, and he said, talk to me about what I needed to do. One of the things is exercise. So that morning, Saturday morning, I was able to get up off the couch and walk through 4 rooms in the house, and I did that 4 times and went back to bed. So that was my beginning of exercise. Through this process, since I was diagnosed with cancer, up until through October of 2013, I lost 40 pounds. With my primary care physician, didn't start me on any medication for diabetes or any insulin. She wanted me to try and control it through diet and exercise. I changed my diet drastically. I started to exercise. I now exercise daily. And I believe very strongly that even though I responded positively to therapy prior to exercising, I believe that it has enabled me to continue to be in the very positive health state that I'm in now. And I would advocate that it's difficult to exercise when you are going through any type of chemo, but you find a way to do it. I found a way to do it. It wasn't easy, but it was one of those turning points where I realized that, there's Elizabeth was talking about those cycles. So, I would get chemo and I'd be fine for 5 days, and then I'd hit the couch for 3 days. And then I'd start to come back. So I had to prioritize my exercise around that as well, because the whole time I was doing this renovation, I will call it, of my physical self, I was in maintenance chemo that whole time. So I think that I advocate that being of good health is very supportive in your fight against cancer.
Thank you.
Thanks, Larry.
My name is Jane, and this is also my first time at the living room. I know we've been in a drought, but I can also tell you that 2 years ago, this week it was raining, because that's when I slipped and fell on my front steps and broke a couple of ribs. And the x-ray revealed that I had a spot on my lung. So we call it a divine fall. All along, it looked like it was kind of the big nothing, which was how I wanted. Yeah, can't see. Okay, yeah, better? Okay,
yeah,
okay. But my nodule was in such a place that the biopsy needed to be in a surgical setting as opposed to a needle biopsy. So, you know, during that surgery, my family was waiting in the waiting room, and that came out, and I was either going to have 45 minutes of surgery or it was going to be more like 4 hours. And it turned out that it was malignant. And the surgeon came out, though, and said, but we're so happy because we got it all. There were no lymph nodes to take from various other, you know, lobes or the mediastinum or anything. So I was released from the hospital, continuing to feel very lucky that I had fallen, that this reveal had happened, and that my surgery had been pretty easy, successful. And then 3 days later, my surgeon called and said he was shocked with the results of my pathology report. And in fact, of the 8 lymph nodes that were in that lobe, 4 of them were malignant, so that I would have to have chemotherapy. And so I went through the traditional cisplatin and Olympta, and I was pretty sick from that. And I was really down and out, actually. And Larry's family and my family are very good friends, and we happen to have been diagnosed in the same week. So we kept reassuring each other that there was a light at the end of the tunnel, and everything that Larry learned and I learned we would share, and felt pretty lucky to be there for each other. One of the things I think that really did help me, as Neil said, was I learned that I couldn't emotionally feel better if I physically felt bad. And so Stanford has programs that you're probably aware of. One is called Live Strong, Live Well, that is free to all, you know, cancer survivors and patients. That is a very gentle, twice-a-week exercise program that the Y all over the Bay Area put on. And just to become physically stronger, I realized was my first step for really being able to fight this battle. And there are many programs. I know I live in Palo Alto, and Stanford has so many programs in the area of exercise and yoga, and whether it's restorative or gentle, that I wanted to share, to check out, because all of this is like being with all of us here. We don't necessarily know each other's names, but we meet eyes, and we smile, and we know that we have a community. And whether that I've bumped into you at Safeway, or at one of these exercise programs, or at the living room, it's just so reassuring to have that kind of contact, I think. And and also this association has helped me so much become my own advocate. There's so many, I've asked what I think, I know there are no stupid questions, but I think I've asked some to Bonnie, and it's just so wonderful to know that I can not feel like I have any stupid question to ask to my medical community. I'm a well-informed person. So, and I'm short and sweet, and that's how it's going to be.
First of all, happy holidays to everybody, the foundation, and everybody else here. My name is Tina, and I was diagnosed 4 years ago. And I just passed my 4th year, and so that was kind of a big thing. Non-small cell, and I started on Tarceva actually right from the get-go, and my doctor was so excited. He goes, "Oh, this is great, because you're probably going to have this mutation, and then you can take Tarceva, and you'll be fine. It'll be great." And and so I did. I took it, and but I just didn't feel like that was being very aggressive. Just taking 1 pill a day. I don't know. It kind of bothered me. I thought, oh well, you always see all these people, you know, bald people and people that look really bad because they've been through this horrible treatment. And I think I probably need to do that. and go through that. I don't know. I just felt like
I need to be sick.
I don't know. I just didn't feel like I was, I wasn't sick. I was just taking this pill, and it was too easy. So we got another opinion, and so another doctor said, well, I think we can really get this, and with aggressive chemotherapy and radiation at the same time. And so I did that, and getting back to, everybody has made comments about exercising, and I'm kind of an exercise nut with jazzercise, and I think that really was so beneficial to have that, to have it and also to do it all the time, because chemo and the radiation, I just sort of breeze through. I'm kind of embarrassed to say that, because so many people have had, they get very, very ill, and I just never did. And I was very, very fortunate in that way. Also, the jazzercise, that's what I do. It was kind of like my little group, too, and I didn't want to give that up. And so I would schedule my chemotherapy after jazzercise and schedule my radiation in the middle of the day so I could go to jazzercise, get my workout in, and then go. So it got me through in a lot of ways. Anyway, I'm sitting here today 4 years later, and I've been taking Tarceva. It just, I started taking it after clear scans, and they just said, this is just a good thing, insurance, let's just do this. And so that's where I'm at, and I've been very, very fortunate. And I'm happy to be sitting here, and thank you to the foundation.
Oh, you're sweet. Thanks, Nita.
Hi, I'm Mary Basso, and I was diagnosed in 2010, October, with stage 4 non-small cell lung cancer. And I started with Alimta, Avastin, and carboplatin for 13 rounds. And then I got the cancer, shrunk really well, and I think the tumor in my spine has never come back since. I mean, it's hiding probably, but it's not, we haven't seen it. But I got really sick from the chemo, my kidneys. So I was in the hospital for like 10 days and almost died. But I got through it, and I did radiation on my lung and on my spine. And then I had 10 months to heal. I had no medicine at all. And then the tumor started growing again, so I went on Tarceva 26 months ago. And now it's stopping working, and so I'm going to have to do something else. And actually right now I'm going to, this week, CyberKnife on my brain. And I want to thank Bonnie and her family. They've helped me and my husband so much. And it's here where we got educated and I found my voice. And I'm so happy because even like today, I had to use it and say, no, I can't have a second treatment today. I have to do it tomorrow, because it was just a shock that I was going to have to do 2 in 1 day. And I know the good Mary, 20 years ago would say, oh, okay, but it just didn't feel right. And I got what I needed. So it's really, first, you have to listen to yourself and listen to your body and speak up for yourself and advocate for yourself, and then advocate for others, because you'll have something to offer them. You educate yourself. I feel like you really have to take care of yourself first, especially when you're first diagnosed, and then always help others. Thank you.
Thanks, Mary. Does anybody in the back want to share their story?
Any talkers in the back?
Any talkers in the back?
Any talkers?
No. Yes?
Okay. Okay. Here's a new little one.
Hi, everyone. My name is Minghua. I was diagnosed in February this year. I'm being treated at Stanford. So it's diagnosed as non-small cell lung cancer, EGFR mutation. Fortunately, my doctor did the molecular testing right away. So she put me on Tarceva, but I got a mixed response. I got the main tumor, pretty good shrinkage after 2.5 months, but then there's also lymph nodes that got either bigger or got new lymph nodes that's light up on the PET scan. So I started chemo and radiation in May. I just finished all the treatment in early October. They did another PET scan end of November. And this time, the main tumor is not showing anything, but the lymph nodes are really still pretty active. We're going to do another scan in a couple months and then decide what to do next. So I'll be really happy to talk to anyone here who has experiences. And also something, I have the radiation pneumonitis right now. Don't know if anyone have some suggestions on that. My doctor just gave me the steroid recently. Yeah, happy to be here. Feel like find my home.
Good, good, good. We have Penelope wants to say something.
Oh, I think, yeah.
Yeah.
But we can,
Okay.
whoever wants to go first.
Okay.
You're it.
Betty Corner, and I was diagnosed in September with what they thought was stage 1 lung cancer, and when I went in for my pre-surgery discussion with my surgeon, he said, no, you have brain mets. So I had 2 brain mets. I had them cyber-knifed. Then I went and had the molecular testing, and I had EGFR mutation. I go in this week for scans, so tomorrow I go in for my MRI, brain MRI, and Friday I go in for my PET scan. So this will be my first set of scans. And I've been very assertive with my doctors. My surgeon wasn't sure he wanted to pursue a surgical route. I have oligometastasis, which is a distant metastasis. They have so far haven't seen anything in my lymph nodes. And I've been boning up as much as I can on lung cancer. And as you learn more, you can speak for yourself much better. And my doctor, my oncologist, was in favor of a surgical approach. My surgeon was sort of, and so I sent him a very rah-rah letter on why I should do this, and he finally relented and said, okay, let's do this in January. So I'm going to, hopefully, if everything is going the way they think, we'll be going in for surgery January 12th. And I've been, since being diagnosed, I've started doing hot yoga. And for everybody, I would say find your yoga. If it's jazzercise, that's fabulous. If it's whatever, biking is great. Hiking, biking, travel. But find your yoga. The hot yoga, one thing I've noticed is I do breathing. I just do tons and tons of breathing in this horribly hot situation. And I finally pulled out that spirometer that they mistakenly gave me in September when they were telling me I was going to have surgery. And I tried it, and my lung capacity has increased. So that's something that medicine didn't give me. That's something that my exercise gave me. And so find things that will make you better and stronger. And I'll let you know next month what's going on with me.
Milwaukee, and I started coming here in 2012. My mom was diagnosed with stage 4 lung cancer, and we were lost. We had no idea what to do. Fortunately, within 2 weeks of her diagnosis, we ended up here, and thank God, because they didn't give my mom much time back then, and had we not come here and found the doctors that we found through the foundation, she wouldn't have made it as long as she did. Unfortunately, she did pass away a year ago now, but this place has been amazing for us. They're like a little family to us now. So we got a lot of information here. The first time that I came, my sister and I came here, and after the meeting, we had a line of people to talk to us, whether it was just a hug or a website or a phone number or something to help us. It was amazing. I mean, everybody here, we were here for probably 2 hours after the meeting ended because everyone was so generous in giving us information. So if you're new to this place, it's the right place to be. You've all been very helpful to us. Thank you. This is my mom right here. We miss her very much, but we were very fortunate that in the time that she did have and the treatment she went through, she didn't miss a day of anything. She has 9 grandkids, and she was always there at their sporting events. I mean, it didn't matter. She was there. So we were really lucky that she didn't have a lot of side effects, and that in the time she did get, she really got to enjoy it. And my dad wanted me to tell everyone Merry Christmas, and he misses everyone, and thank you for everything you guys do.
Thank you.
Let me see the mic, or we can pass it. I don't know, Chris, if you still have, oh, Andre's got one. There we go.
Hi, my name is Susan. I was just diagnosed in October, stage 4. Total shock, I'm sure, as it is for everyone. I just went through radiation because I did have some spots in my brain and on my vertebrae. So they did stereotactic. I'm going to have my first scan in February. We just scheduled that today. I did test positive for the EGFR mutation, so I'm on Tarceva, which also works in the brain, so we're hoping that that'll also take care of things. Until learning about this or coming here, it never even occurred to me to maybe try something other than Tarceva, or, you know, it's like, well, this is so great, why don't you just do this and write it and, you know, see how it goes, because there are literally almost no side effects. Got a little bit of a rash. So now I'm wondering, you know, maybe that's not the best choice, or I don't know. I just like that all the information we have here, and I did watch last month's living room that you had with the doctors that talked about the T-cell therapies and the vaccines and stuff. So I know there are things out there. We have a friend who's an oncologist, and he believes firmly that it will be a manageable disease at some point. I just don't know that, you know, Tarceva, I don't know if anybody's just been on Tarceva and nothing else for a long time and had that work. Because I've heard, oh, somebody's on it 10 years, 8 years. But, you know, did they do anything else, or was it just that? So this is my husband, but that's my story. And thank you for being here and doing this foundation. It's wonderful.
I think there's, thanks, Susan. I think there's some people in the room that could tell you their own Tarceva stories and how long they were or weren't on it, and how that varies for a lot of people. And yes, there are people who have been on it for 7, 8 years, 10 years actually, that we know since it became, right?
Right. There's one patient that came to our very first foundation meeting, and she's been on Tarceva so long, I think she's totally forgotten she has lung cancer. Mm-hmm. And she's out living her life, and you know, we don't see her anymore, which is great. That's absolutely fantastic. So I'm sure you're doing all the right things.
And with that being said, I think one thing I do want to say that is important is, what's your plan B? Right? If and when, what's your plan B? And always keeping up on what's happening right now with EGFR, with the mutations, with the more common resistance pathways that can develop with that mutation? Are there targeted therapies that go along with those? Keep your ears open for new resistance pathways that come up. Who's working on drugs to target those? Because those things are going to be the things that we've had a lot of patients say, help me sleep at night. If I know what my plan B is going to be, then I'm perfectly good with plan A working for as long as I can get it to work.
Exactly. And you know, Terry's daughter Natalie found out a while back after having another biopsy that she has a ROS1 mutation. So she's got that in her back pocket, and she knows if her cancer resurfaces and that Xalkori is going to be an option for her. So to Danielle's point, there's a lot out there, and you always need to know what the next steps are, so it's not guesswork when it happens. So, and there's lots of things out there for progression on Tarceva.
Like I said, we are, you know, information central. So, anytime, you know, the Monday through Friday, 8 to 5, somebody's usually here, and after that, everybody is available 24/7. Our cell phones go out to every patient we work with. So,
yeah,
it's fantastic. Thank you.
Danielle, if I could.
Yes, grab a mic, Neil. That's all I'm going to ask.
He hardly needs a mic.
I know. It's like Scott. It's a Northeast thing. They're just, right?
Screamers.
Hello. Yeah. Okay. If I could add, whom I think also needs to hear our voice as patients are all the companies that we deal with. So those of us who have had CyberKnife, you know, I made it one of my missions to talk to Accuray and send them a note of all the changes that I think they needed to do to make my experience better. And a lot of them had to do with the mask. And I have a number of masks. And 2 years later, so that was just about a month, 2 months ago, they put a mask on me that had every one of the changes that I listed. Now, I don't know if it came from me or where.
Oh, it did.
Maybe it was their design team. But it was like incredible that they got it right. So everybody having it from now on has a better experience. And you mentioned, and a lot of us who've had Tarceva, you know, have taken it for a while. You know, some people a year have gotten good results, perhaps longer and not good results, and finally it doesn't work. But in my case, I decided to tell Genentech, they're local, I wanted them to know what I thought about it. So I contacted them, and I went there, and they heard from me. And if I take something from Celgene, who's here, they'll hear from me. But I haven't taken anything yet. But Clovis, the company that was on my trial, they heard from me, even though they only knew me as a number. So I think we as patients, we need to tell the people who are making devices that we're utilizing and really that are helping us a lot, or the companies who have worked on and discovered different treatments that we've all taken, they need to hear from us for a lot of reasons. One, I want them to know, and I think you do also, how great it is, the work that they're doing. You know, they're going to an office every day, they're doing their work in the lab. I want them to hear our feedback and tell them that we appreciate what they're doing. But also, if we have some critique, some criticism for them, that this is what they could do to maybe make it better, a better patient experience, maybe on the CyberKnife platform that we lay down on, why couldn't it be Tempur-Pedic? Well, I said that to them, and they showed me the next generation, and it was memory foam. So they're thinking about it. But if they hadn't, at least they would have heard it from me and maybe somebody else.
Neil, could you call the MRI people and see if they can make it a bit bigger?
Now that would be good. I finally figured out quieter. I have written to Siemens a couple of times and asked why they can't have noise cancellation. It's a wave, it's crazy noisy, and each time I've gotten back, we're working on it. So I said the next time, work faster. All right? You know, I can only figure out the way I'm dealing with it so many times before it drives me really crazy. You know, I've got my mechanism for dealing with this claustrophobic tube for 45 or 50 minutes, And it works as long as I have a certain amount of light to see. But it would be a lot better if I could listen to real music.
And Xanax.
Yeah, it was Xanax. Well, I don't like to take pills, but you know how that goes.
I do it in MRI.
So I just urge you, you know, besides telling your doctors, and I have a doctor who indulges me, and I have a neurosurgeon who I tell crazy things to, and always nods and says, that's an interesting idea, but that'll never happen.
Right.
But at least they'll listen to it. So we need to talk to them, express our opinions, as many of you have said. How else do they know? They haven't gone through the treatment. I asked the people at Accuray, I asked the president of the company, have your senior staff ever gone through a simulation? He told me no. I said, well, how do they know what it's like? All right, so it doesn't have to be the radiation. You can still be in there for a while and have the machine go around for 45 minutes, go beep, 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 and wear the mask. Wear the mask, get waterboarded, first of all, see what that's all about. So he said he'd do it. All right, but how else do they know unless we tell them?
That's right.
All right, so it's our responsibility to do so, and hopefully the experience gets better for all of us who then have to go through it. And we need to talk to the infusion lab directors and tell them what we think about it. Yeah, we go in, the needle goes in, you're there for 6 hours. Okay, how was your experience?
Warm
Talk
blankets.
You know, let
warm
them know.
blankets.
Yeah, do it. Yeah, warm
Slippers.
blankets. Absolutely. I personally went to talk to the person in charge of the CT MRI at Stanford, and I talked to his secretary, whomever, said I want to talk to him. And when he came out, I know that what he was thinking was, I'm going to get harassed, you know, I'm going to hear complaints and everything. But when I first said to him, I want you to know how great your people are, I watched his body change from defensive to, oh my God, someone gave a compliment here. So many times it can be that. It doesn't have to be a negative, because that's typically what people will do if they've had a bad experience. But if your experience is great, or good at least, tell the people. You know, the nurses, they're bombarded 10 hours a day, they're there, and they get a lot of the negativity they have to deal with. But if they've done a great job, bring them a cake the next time. All right? They'll love you. You know, they'll know they're appreciated. Same with all the others. You know, we forget sometimes to do that, and you know, it's not confrontational. We want all these people to be our partners. And if they're our partners, we end up with better results for all of us. So we have to just remind ourselves, put it on a little card, read it, say, be nice today. Okay, I can do that for 10 minutes, you know, and that'll be good, you know, and maybe it'll help make their day.
That's right.
Because we do that, we also learn a lot from them. They help us out also. They're people. They can very easily get lung cancer or anything else and be in the seat that we are.
My oncologist got stage 4 lung cancer.
Yeah. May I say, too, something that Bonnie made me do after I had surgery, and I thought, oh, I'm fine. And we were at lunch, and she mentioned something about a pulmonologist. Well, I'd had a very unpleasant situation with an oncologist that I was sent to see, not an oncologist, excuse me, a pulmonologist. And so I said to Bonnie, I don't need one. My cancer's gone. And I don't need to see a pulmonologist. Bonnie said, you might not need someone now, but you need someone that down the line's going to know your history, know what you've gone through, and be fully aware of your whatever breathing problems, which, knock on wood, right now I don't have any, but I'm very thankful that you got me to go to a pulmonologist, and I know she's there. She has me come once or twice a year, and I get pulmonary function tests, which have been really good. They got better as time went on after surgery. And in fact, Bonnie also told me about the flying, the altitude. They have a test to see your oxygen level when you're up flying in an airplane. And I'd flown 2 times, and I've said, oh, I don't need that. Well, I flunked the test twice, so I had to fly with a POC for a while. Now I'm past that, but I thank you for that, and I think it's important for every lung cancer patient to have a pulmonologist in the picture with them.
I agree, very much so.
One of the things I just want to tag on to something that Neil said when he was talking about patients and advocates and voices, and we've been doing a lot of talking about that tonight, is I wanted to give you guys a skosh of good news, and it has to do with that very thing with the patient voice. So there was a lung cancer patient advocate group, ILPAC, I don't know, I can't remember what the acronym is. There's so many acronyms. But it was basically a group of patients who got together and decided to go to NCCN with some comments on how they felt about what was stated in NCCN guidelines about oligometastatic disease. And Betty, I heard you talk about it.
NCCN guidelines are.
Yeah, so I think for those of you who may not know, they're guidelines by which standards of care are created, right? So doctors hopefully are following at minimum NCCN guidelines for whatever your type of cancer is. That doesn't always happen, but at minimum, that's what we hope is happening. So anyway, this group of folks, and we signed off with them early on this to help and try to get it passed. And the good news is that just earlier this week, it was announced that NCCN guidelines were changed insofar as how oligometastatic disease was being treated. So it used to be a single distant site, and now it can be up to multiple sites, and radiation that can be involved, and all of these sort of things. So these are the types of things, and for anybody who's interested in the entire story, and it's a lot, and all the people who are involved, the docs and the people who signed on, I'm happy to share this with you, but it's a really good example of just how powerful your voices can be, because this is a big deal. Getting something changed in NCCN guidelines is a big, big deal.
NCCN guidelines are a Bible for physicians, especially community physicians that don't go to a lot of CME and a lot of these, lung cancer meetings and things to get updated on new drugs and what's new in the world. And they literally open the guide and they say, okay, you're stage 3B, carboplatin, Taxol, boom, done. So the patients had a voice in changing this and adding some things in there that will make their lives much better. So,
yeah. And I think it's important. Yeah, I mean, it boils back down to, well, I can't say it enough how important your voice is in so many arenas, whether it's in helping to create guidelines, whether it's in talking to your physicians or talking to Accuray about the mask, or talking to insurance companies and payers about all the million things that we know are wrong with that, right? And you have no idea how powerful when you come together those voices can be. They're very, very powerful.
And the reason, especially the payers, this is a huge issue for all of you. They're pulling back more and more and more about what they pay for and, what therapies. Doctors, with all of these new things they have for lung cancer now, the physicians are really wanting to prescribe those things, and the payers are saying, no, we won't pay, because that's only approved for second line, or it's only approved for third line, not approved for first line. Your voice can be huge in that, because they don't listen to pharma, because they believe that pharma has a vested interest. But they know you don't have a vested interest. Your only vested interest, as ours, is survival and getting the right drug at the right time. So we may call on you at various different times to sign off on letters that we're writing to the payers to get them to approve certain things.
And it's so funny, because every time we get together to do one of these roundtables, I worry that we're going to run out of things to talk about, right? And because I worry that we're not bringing a speaker in to talk about something about your disease at that moment, that where you could have them in front of you and ask those questions. And I'm always so amazingly surprised and inspired to see how fast this 2 hours goes, and how there's plenty to say. And it's so important, and I hope that you all have learned a ton of things tonight from one another, and I hope that we can continue to make this an amazing space. Unfortunately, we don't have time to go through the survey stuff.
Oh, no.
Oh, no. Not in any kind of detail, but I can just read real quick some general overall, just for those who are interested, and then to kind of come back and circle back with Michelle or I or my mom about the comments and suggestions, or Andrea too.
We got no questions.
You know, about, no, we got no online questions. That's okay, because it's not really a question thing and nobody wanted to share their story. So.
No, everybody's, Tom said his little girls were so excited they felt like they were famous.
Oh, because we talked about them on TV.
A couple people wishing us a happy holiday, but the best part about tonight is everybody was supporting each other online,
Yeah.
which you don't see very often.
So while it's happening in the room here, it was happening online. So that's amazing too. So some of the things, and like I said, I think a lot of you saw this survey, and one of the things that sometimes we struggle with is, do you or do you really not, outside of really this arena or any patient programs thing, understand what it is we do, what we raise money for, where that money goes, and how we're trying to really affect change in this space. And I was pleasantly surprised to see that 96% of the people that filled out the survey felt pretty strongly that they understood the scope of who we were and what we're doing, which means we're communicating somehow, right? We're communicating. When it came to who was using what, the living room, of course, was up in the high 60%, whether you watched it online and or in person. One-on-one support. I mean, everybody seemed to be using everything, which was amazing. One of the questions that I found really, I don't want to say surprising, but made me feel good about what we do was, do you feel that what you've learned here has had a direct effect on your care in a positive way, right? And so, let me find that one. Or do you feel you've gotten better care based on this? 93% of the people that filled out the survey feel like their care is better because of what they've learned here and been able to bring back to their physicians. So that, I think, speaks volumes about how proud I am to be in this space and to be able to bring to all of you what we're able to bring to all of you, right?
One of our doctors came in here and said that he didn't even know why he was here because he thought our patients were smarter than he was.
Yeah, so those are just a couple of things that, again, this is why we appreciate your feedback. I have a long list of comments about some pretty incredible things that people said about who we are and what we're doing.
Are you going to put that online so everybody can see it?
Yeah, well, people filled it out anonymously, so I mean, I could post it online if anybody is curious about what some of this looks like. It was really exciting, though. So,
did anybody?
Going forward, what improvements do you think that?
So yeah, you're putting me on the spot.
Yeah, of course.
No, you know what? I learned that there's a couple of things that we need to do better, and I know that. And as the person who's in charge of this patient services and programs, that's what I want. I want to do better, and I want to bring to you guys, whether you're a patient or a caregiver, and whether you're here locally or whether you're in Nebraska or Australia, I want to be able to provide you with whatever it is you need. So without surveys like this, I can't get that feedback to know where we talk all the time, or I talk all the time about, okay, there's all these gaps in lung cancer and how can we fill them? There has to be gaps here, and I want to know how to fill them. I mean, it's my job.
So give us an idea of one of the things that they thought we could do better.
Well, ironically, nobody really talked about things we could do better. I mean, if I read through, I mean, I'm telling you, most of it is comments and suggestions, and they're all like, you people are wonderful, and I don't know how or where I'd be without you, you know? So I think there needs to be on the next questionnaire, or survey, there needs to be a line that really says, literally, where do we have gaps and how can we fill them? Because this, I think, left it open to more positivity.
Was there any lectures that they liked more than others?
No, but that was one of the things I was hoping we were going to talk about tonight, about what I have it on this I did have an agenda for tonight. We never actually got to it, but talking about suggestions for speakers and whether or not patients are interested or caregivers are interested in workshops where it's maybe an all-day thing, where it's or a weekend thing that happens here where between 10 and 11 is this, and between 11 and 12 is that, where it's more of a a sort of across the board type of thing, from a medical standpoint to maybe a spiritual one, or therapy and people needing, sort of that, psychosocial, or if it's about a payer situation you need help. So anyway,
for the new people here tonight, we don't usually do this to this level. We usually go around and people give us updates, because you get to know everybody in the room and you kind of get that feeling. And then we have someone do a lecture. It could be someone, an expert on genomics. It could be new drugs. It could be, some kind of new treatment, various different things. So.
And then about once a quarter, we try to have just this general around the room. Before and after the regular living rooms, a sort of meet and greet, and when patients get to talk and you get some one-on-one time with us. So anyway, with that being said, I'm happy to share this, and thank you all for again who participated. I do have to do, because I'm getting the thing. That's the Danielle. You need to stop talking and. Okay.
That's not easy.
Yeah, I know. So just a couple of events. You guys know I always talk about some things that are coming forward, especially for people who are online. Events coming up on January 24th in Irvine, California. So if you plan on being in Southern California, if you know anybody down there who might want to participate in our 5K down there, it's a great event, January 24th. February 21st, a fair to remember out in Tracy. And Melise, who you guys have all met before, or most of you have, who works on the events team, is hosting that in her hometown of Tracy. March 1st, Tempe, Arizona, 5K. March 4th in Rochester, New York, the Clark family.
You have a sing out too.
Yeah, that's coming. They're hosting at Alex and Annie in Rochester. Proceeds are coming to the ALCF. So if you know anybody in Rochester. March 7th, Gainesville, Run Amok. And then March 22nd with Upstage Lung Cancer and Hildy Grossman, which Hildy has a nonprofit in Boston. And we're having a sing out in Boston with the ALCF.
We're not singing.
Thank God. Yeah, oh boy. And I wanted to, I actually wanted to take some time for my own personal, I'm being a little selfish right now, and talk about and give my thank yous. This is the holiday time of year, right? And there's so many things that I'm grateful for, and I think that, well, sometimes you worry that you don't take time enough out to say thank you to the people that matter, and all of you have touched our lives in ways that, and by our lives, I mean every person that works at the foundation, in ways that you can't even imagine. You continually inspire each and every one of us, and remind us why we're doing what we're doing and why it's so important. And I say all the time, and I know my sister says all the time, that this started back in 2003 when our mom was diagnosed, but it's come so much farther than that. And you have no idea. I mean, I don't want to get like super emotional about it, but no idea what you guys bring to each and every one of us that work here. The staff that works here, we are family. You guys are our family, and we are family here, and I can assure you that every single person that works on the staff, whether it's Nicole who answers the phones up front, or Minnie who comes and cleans up after us over on the weekend,
which is quite a mess.
We are here, and we are committed, and I've never been so fortunate to work with a more dedicated, committed group of people who are truly at one another's beck and call. And this is, I mean, it's not an easy job. You guys have a really tough job, but it's not an easy job, for us either. So I just want to thank everybody for all being family and team. And I want to primarily thank my mom. This is where I get like super emotional right now every time you talk about your mom.
I'm not your mother, did I tell you? No.
Yeah, she tried to tell me that a long time ago. But without your strength, seriously, and your passion and your vision and your, none of this would happen. None of it would have happened. And nobody ever wants to say, oh, I'm grateful that you got lung cancer, because I'm not. But what I'm grateful for is what I have learned because of you getting lung cancer. So huge thank you to Mom. Somebody said something earlier about paying it forward. Was it Neil? Was it you? We were talking about.
Probably.
I can't remember. Was it Chris? Was it you? We talked about paying it forward. I mean, that's what. Right. Yeah, and Liz talked about it too. So again, thank you. And now that I have to thank the people who's without their financial support, we couldn't do any of this.
3 minutes.
Yeah, Merck, Genentech, Lilly, Novartis, BMS, Celgene. The longer this list gets, the more we even realize what we're doing and how important it is, because they get it and they realize how important this space is for all of you. So a huge thank you to them. Obviously, Peninsula Television for coming in every month, even in the rain, unpacking all this equipment, and making it possible to bring it to the 143 countries that this show has been viewed in. So that's a huge, huge thing. So a big thank you to Penn TV. A huge thank you to The Office Bar and Grill, although they did not do the food tonight. They do every month donate the pasta night. So I want to give a huge thank you to them. And I think I'm done thanking people. Is there anybody you want to thank? No? Oh, and to everybody at home, have a happy, 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 happy holiday, and a happy and healthy New Year. Please, we're gonna let everybody have some more wine and enjoy some of this food. And for everybody in the room, there's cheesecake and creme caramel or flan, depending upon which country you're from, on the table over here, and some cookies. So please, please come enjoy. Thanks, everybody.